Good afternoon, everyone. It is so good to be back with you. I see many familiar faces and some new faces as well. So thank you for joining. By way of background, my name is Jill Nash. I'm the founder of Women Forward. We're a national grassroots group that got its start early in the 2020 primary. We are essentially a group of women from different campaigns who all coalesced behind Joe Biden. Um, and we started out as Women for Biden Harris, and we worked really hard. And by the time the campaign or the election rolled around, we had 750,000 women from all 50 states joining in the fight for our democracy. We kind of thought after Biden won that we would go back to our lives and all was happy and rainbows and unicorns. And then January 6th happened, and we all looked at each other and said we have to stay in the fight. When Joe dropped out and Kamala became our candidate, we grew to 1.5 million women. And we've maintained that number now, and we are gearing up for the midterms in 2026. We currently operate formally in about 47 states. And if you want more information on us, you can find that at womenforward.us. Now, today you are in for a treat. We are so fortunate to have Dr. Nirav Shah joining us. He's an epidemiologist. He's an economist. He's an attorney. In short, he clearly is an underachiever. Um, some of his roles as a public servant have included being the director of the Maine Center for Disease Control and Prevention. And he did just a stellar job of leading the state through the COVID pandemic. In 2023, he was appointed to the CDC as a principal deputy director and then acting director. He's currently a visiting professor at Colby College in Waterville, Maine, where he teaches courses in public health, epidemics, and crisis communications. Dr. Shah, we are thrilled to have you here today, and I know you're going to give some opening comments, but many of us have a question for you. So clearly, in this environment that we're in, many of us wake up in the morning and we read the news, and it immediately gives us a headache. And so the question for you is, do you take Tylenol?
Uh, the answer, Jill, is yes, and you should continue to feel safe doing so. So we will start with that piece of very concrete, actionable advice. And Jill, and to our friends at Women Forward, thank you so much for organizing this gathering and for inviting me to join. I'm really excited for the conversation, as well as where we go with the Q&A. And Jill, thank you so much for your leadership on these matters. As you're going to hear me talk about, the plight of our nation's healthcare and public health system is dire, and sadly looking even more dire as we look into the future. And so right now, this role of organizations like Women Forward and the role of each and every one of you to organize yourselves and to engage in grassroots organizing and activation is particularly important, and indeed is probably the surest pathway toward protecting our rights and our healthcare going forward. That's a point I'm going to come back to at the end as well. But let me first start by acknowledging something, and Jill sort of alluded to this in her question, which is right now, with respect to healthcare and public health, it's easy to read the news and the headlines of the day and feel confused. And one of my messages for you today is do not feel alone in being confused. You are not alone in feeling bewildered because of all the topsy-turvy changes that are happening. You and everyone else are confused about, well, I thought yesterday the advice was this, but now it's the opposite. What is left? What is right? What's up? What's down? That confusion is natural, especially in the moment we are in with being whipsawed. But more importantly, that confusion is part of the point. The confusion is not a byproduct of mismanagement on the part of Secretary Kennedy. The confusion is part of the strategy. It is a feature, not a bug, of their approach. And ultimately, they want you to be confused so that you ultimately elect not to get your COVID shot this fall, not to get your flu shot, not to get your kid vaccinated, and not to advocate for your rights. Something that, again, I will come back to at the end. But what I want to first do is spend the first couple of minutes deciphering and demystifying and highlighting some of the areas in which Secretary Kennedy, President Trump are systematically dismantling our healthcare and our public health system, and in so doing, taking away the protections that we all, but particularly women, have enjoyed for decades upon decades. And I'm going to zoom in on a few areas in which this dismantling really affects populations and particularly really affects women. And the one that is top of mind for me right now is Secretary Kennedy's efforts to precipitate a comeback in vaccine preventable diseases. This administration is really bad if you're an American, but it's really great if you're a virus. And the reason being is that Secretary Kennedy, in whom President Trump has appointed Secretary of Health and Human Services, is a vaccine conspiracist who exaggerates and outright lies about the risks that come with vaccines. He has filled a critical, important panel at the CDC that shapes vaccine policy with outright conspiracists. And he's put into place roadblocks that, for example, make it just that much harder to get a COVID vaccine, even for vulnerable people. He's made it just that much harder for families to get needed childhood vaccines. And he's made it just that much more difficult to figure out what the best advice is for you and your family. And so, one thing I want to do right now is equip everybody with, or actually, we'll come back to that in the Q&A, of the best things that you can do right now to protect you and your family as we go into the fall and winter. But the first thing that they are doing is systematically precipitating a comeback in vaccine preventable diseases by putting vaccines just that much further out of reach. The second thing, somewhat related to that, is they are jeopardizing our overall pandemic preparedness. I mean, one of the questions that's been on everyone's mind since COVID is, are we ready for the next pandemic? And in the Biden administration, we took very concrete steps to shore up our nation's readiness to prevent, to detect, and to respond to whenever the next pandemic arose. Many of those many of those policies, many of those programs, and many of those personnel have been dismissed. For example, the United States withdrew from the World Health Organization, a critical forum for sharing information. The White House dismantled the Office of Pandemic Preparedness and Response, which was the central coordinating agency across the US government. And the CDC has largely been gutted, particularly its global staff, who were manning and womening the watchtower to make sure that if an infectious disease arose in another part of the world, we were the ones who would know about it first before any of our adversaries. All of that infrastructure has now been dismantled. The third area in which this dismantling is really affecting people is in the mere fact that the Trump administration and Secretary Kennedy are taking away healthcare. It's as simple as that. And we've all seen it, and now people are starting to feel it in real time. The recently passed domestic policy law, the so-called Big Beautiful Budget Bill, which is none of those things, will probably leave, at least early estimates suggest, 10 million Americans without health insurance. Many of you are tracking the pending shutdown of the federal government. The clock right now is suggesting 6 hours and 20 minutes away, where if there's not a deal reached, the tax credits that numerous Americans rely upon to secure health insurance at an affordable rate will go away, making health insurance even more inaccessible for legions of people across the country. I'm going to come back to the implication of that specifically for women in just a moment. Finally, the area that is forward-looking and equally concerning that the Trump administration is dismantling is stymieing biomedical research. Biomedical research, like the kind of research that's supported by the National Institute of Health, is only about 0.6% of the entire federal budget. And yet that too is being taken away and dismantled. And the implications of that are really so spectacular that we don't even know what they might mean. But we are looking at a future where the US is not leading biomedical research, but rather systematically behind compared to other countries. We've pretty much hung up the towel or thrown in the towel on mRNA vaccine research. That in and of itself leaves us unprepared for the next pandemic. But more importantly, you can guarantee that other countries are not going to let themselves fall behind. And so we're looking at a world where, for the first time, cutting edge therapies, cutting edge diagnostics, cutting edge medicines might be available not to you and your family in America first, but to the families of other places. And we may not even have a shot at getting those shots until something significant has already set in. In effect, notwithstanding the fact the Trump administration claims that they want to make America great again and put America first, what they're actually doing is letting America fall behind from a position of authority and expertise that we held in healthcare for nearly 80 years. Finally, the one area that is particularly concerning is the absolute target that has been placed on women and women's health in this moment. Jill and I already referenced the Tylenol debacle, which is again another example of deliberate confusion. And we can talk some more about the politics of that. But it doesn't end there. The HPV vaccine is being systematically undermined and questioned, which could lead to a resurgence in cervical cancer rates across the country. Funding for reproductive health under Title X has now been completely shut off, which will leave scores of women across the country not just without reproductive health services, but without primary care services. In short, the Trump administration and Secretary Kennedy are undermining our health and our safety in almost every way. The bottom line is that Secretary Kennedy should resign. Now, how do we find ourselves protected in this moment? Well, enter the role of state governments. It will be through state government that our rights, our healthcare, our freedoms, and indeed for many of us, our entire entitlement to live, our existence, is protected. All of those things are under attack right now, whether it's our reproductive freedoms, whether it's our ability to access public health, or for many trans individuals, their very right to exist. But the place in which that will be protected is via state government. All the more reason that activating and organizing is of critical importance at this moment. Thank you all for the invitation. Jill, let me pass it back over to you.
Well, that was sobering. Well, okay, so you're talking about state governments. Can you talk a bit more about the West Coast Health Alliance and the Northeast Public Health Collaborative, and kind of where those fit in, and how effective you think they will be at counterbalancing a lot of the misinformation coming out of the CDC?
Great. So, as you noted, Jill, those two regions, the state health departments and governors in those regions have organized to take matters into their own hands. If vaccines will not be recommended or provided for by the CDC because it has been compromised, then states are taking that mantle and doing it on their own. And I applaud the health secretaries and governors of those states for getting together to take this problem on head on. Jill, you raised the good question of whether they will truly be able to counterbalance the authority and the advice and the funding that was previously provided by the CDC. I think with respect to recommendations of vaccines at the state level, they will be able to stand in and ensure health insurance coverage. But the funding remains a challenge. And so that is an area where the CDC doesn't provide just technical assistance, it also provides funding. and that may be withdrawn, and that will be a significant hole. So, Jill, my view on these collaboratives is that they are the right example of leadership for this moment. But in the best case scenario, we would not need to rely on states going this route on their own. We would still have leadership from the federal government and the CDC. The fact that we don't is unfortunate and telling, but states are going to get the job done.
Okay. Now, you mentioned the ACA and people losing their health care. As programs are cut, what are the implications to rural health services? But can you also explain why those changes are not just going to impact people in rural areas of the country, they're going to impact all of us?
Great. That's a great question, Jill. I mean, in increasing parts of the country, if you are a pregnant person, being able to have a baby safely in a place where there are skilled healthcare workers around is no longer a right, it's a luxury that is available to an increasingly small number of people. Likewise, in increasing parts of the country, if you have an accident, the time that you might have to wait for an ambulance to show up is beyond the golden hour in which EMTs can make a difference in the earliest phases of an accident, to say nothing of the shuttering of other types of services, particularly behavioral health services. And so, if you're experiencing a mental health crisis, increasingly across the country, care is out of reach. I also already mentioned the shuttering of a lot of Planned Parenthood and other reproductive clinics, which for many women are their primary care sources. So the problem is acute and getting even more acute with each passing day, not just up here in our neck of the woods in Maine, but across the country. And that is unacceptable for where we are in this country. What does this mean, though, beyond just the rural aspects of the state? Well, I think there's this notion that rural health is different in some way, and that rural communities, in effect, are separated from urban parts of the country. But that's not the case. We are all connected. When rural parts of the country, when healthcare closes in a rural part of the country, many people leave. And it's not just people, but it's factory workers, it's farmers, it's folks that live and inhabit those communities and provide for a lot of the social fabric that we have, whether it's food, whether it's other aspects of manufacturing here in Maine, it's a lot of our working waterfronts. When folks don't feel that they have health care, they may not stick around. They may move to other parts of the state, of the country, and that undermines not just their lives, it doesn't upset just their lives, it weakens our entire economy as a whole. And so rural health isn't just rural, it's really healthcare for everybody. And when it goes away, we are all worse off.
Thank you. We have a question. We're getting so many good questions in, and please keep those questions coming. We have a question from a Mainer. What's your opinion about what we all need to do in face of the hundreds of thousands of under-vaccinated children bringing back diseases? As these childhood viruses resurge, is it possible for them to morph into new and more dangerous versions of themselves? Are those of us who have grown up being vaccinated at risk?
Great. That's a great question, and shout out to a fellow Mainer up here. The answer is that it varies by virus, but at a certain point, if vaccination rates fall either across the country or in pockets, the possibility of an outbreak of measles or pertussis or diseases that, frankly, a lot of physicians haven't seen because vaccines did such a great job of eradicating, the risk of those diseases reemerging goes up. Now, to my fellow Mainer, please note that Maine continues to have some of the highest vaccination rates in the country, not just for COVID, but for all of those other diseases. And that right there tells you a lot about the ways in which Mainers take care of themselves and each other. But make no mistake, we are already seeing a resurgence of diseases like measles that was on the cusp of elimination not long ago, it is now making a comeback. Significant outbreaks in West Texas, and eastern New Mexico, a burgeoning outbreak right now in Utah. Now, are vaccinated folks at risk? Not at this moment. If you're vaccinated against measles or mumps, then you're in good stead because those vaccines are tremendously effective. But as things change and vaccination rates dwindle, that safety is not assured, particularly for some other diseases like pertussis and others, and meningitis. And so as my main colleagues know, I try to be even Steven about these things, but make no mistake, we are quickly approaching a place where the health security that we've all felt is going away, and we could see a resurgence in diseases that frankly have only existed in the textbooks for the longest time because of Secretary Kennedy's diminishment of the importance of vaccines.
Let's talk about Secretary Kennedy for a minute. I think we are all in violent agreement with you that he needs to go. What should the women in this group and women outside of the group that are our friends, what should we be doing to help that along?
Okay. First, I'm going to answer the question you didn't ask, Jill, but I think is really important. It underlies that question, which is first, what should all of us, but particularly the women in this group, be doing in general? And the first thing I ask you to do is to not be confused into complacency by the whipsawing of Secretary Kennedy. As I mentioned, that is, I believe, part of his strategy to throw so much mud in the water that nobody, or dirt in the water, so it's so muddy that nobody really knows what's left or right, whether I really need the COVID vaccine, whether I really need the flu shot. Do not be confused. Seek information from credible sources, such as your doctor and others that we can talk about, so you can stay informed and so that you can take care of your friends, family, and community. Now, from a political perspective, Jill, to the question you asked, right now, organizing is important. I'm going to offer two or three very concrete solutions. Number one is, as I mentioned, many of the rights, freedoms, and protections that we've enjoyed will be continued at the state government level. Now, I hope that is at all 50 states, but I fear a world in which we have a two-tier healthcare system in the country. And that if you're in a blue state, you get vaccinated and you get access to healthcare. And if you're in a red state, it's this libertarian choose your own adventure state. That is not a good way to go about healthcare and public health, but I fear a world that we may be approaching. So the state government is going to be where it's at. And so my ask is that every single person here activate and organize, making sure that your state government knows that they now have an obligation to protect your rights and your healthcare freedoms is more important now than ever. If you haven't met with your state rep, if you haven't met with your state senator, now is the time to do so to make your voice heard. Secondly, letting your congressionally elected officials, your senators and House members know that you think Secretary Kennedy needs to go. That is the way in which we can make sure the voices are heard across the country.
Um, thank you. I think we all need to be doing that. One person asks a question, and you could say that it's in jest, but in this environment, I don't think that it is. Does the government want us to die? Like, why is this happening? It's
You
so,
know, yeah, I get where that question comes from. Because sometimes you wake up in the morning and you look at the litany of changes they've made domestically and globally, and it seems like the only conclusion is they don't care about us. And I understand where that comes from. My answer, Jill, is I think what they are trying to do is a few things. One is I don't think their intention is to cause widespread death. To be very clear, I think they're doing something that's probably just as sinister, though, which is to undermine faith in just about every aspect of government and healthcare, so that if people end up dying because they could have been vaccinated but didn't, or they could have followed a healthy diet, but instead ate beef tallow, then that's too bad. And I do think that that degree of callousness is there. Um, Now, what the secretary will often do is sort of a one step forward, eight steps back. He'll take one small step forward on something like food dyes. Although there too, don't be deceived. No manufacturer has actually agreed to take food dyes out. It's just discussion at this point. But he'll have something that seemingly we can all agree on, food dyes, but then simultaneously take eight steps back on. Even the areas where the secretary has identified that might be areas where we generally agree, like the health and safety of, or the health of our food supply and the challenges with ultra processed foods, are small ball compared to the bigger task that he's doing, which is to undermine outright confidence in our healthcare system. As a reminder, when Secretary Kennedy gets presented with information that challenges his views, he responds or resorts to the same playbook. Oh, you're a big pharma shill. You didn't study that in medical school. I did. His playbook is very, very predictable. What I've urged my colleagues in the healthcare world to do, and that I will urge you all to do, is don't let him make that move. Call him out before he makes that move, because we know what his playbook is going to be.
Hey, I have a question. Isn't it illegal for a non-medical professional to dispense medical advice?
Well, it is, it's certainly, and the secretary cloaks himself in the idea that no one should take what he says as health advice, which is exceedingly telling when your title is Secretary of Health.
Yes.
If you're not going to take the secretary's advice, then what are we doing here? And so I think his move there is a little bit too glib. But what I should also say, Jill, is if he doesn't want to dispense advice, then he should defer to his CDC director, who he fired after 28 days.
Right, right. So this is a question from New York. What do you see as the biggest piece of misinformation that's out there? And how do you recommend we combat misinformation and disinformation in our communities?
Great. To me, the most glaring pieces of the misinformation have to do with the idea that vaccines are unsafe or ineffective. And let me decode the move that Secretary Kennedy makes. In addition to having just glaringly misrepresenting the data, he does two things that I think are important to call out. Number one, he only looks at data that seemingly agree with him. This is confirmation bias. It's one of the most pernicious problems that faces people, but he only looks at data that agree with him. The second is this sort of what I call the blank slate fallacy. In Secretary Kennedy's world, vaccines just dropped from the sky yesterday, and we don't have any data on them. And so we need to replicate and redo all of these studies so we really know whether they are safe and effective. When in fact, there are about 8 decades worth of data around the safety and effectiveness of vaccines. But he would make you think as if we have none of this data. What can you do to combat this in your community? By my lights, there are two things. Number one is really one of the only effective ways to push back on misinformation is to engage in what is called pre-bunking. You know when someone is going to spout off something that the secretary has said. Don't let them get to that point. If you're engaging with them on Facebook or elsewhere, say, look, this is the facts, and I know what you're going to say. You're going to say this guy's a pharma shill, but he doesn't have any record of actually ever taking any money from pharma, so don't try that one. Cut it off at the pass. The other, though, might seemingly cut in the opposite direction. But we have to approach these conversations around when someone is spewing misinformation. We have to approach them not the way a high school debater would. That's what we often do. We think of these discussions the way a high school debater would. And in the history of recorded thought, no one's mind has been changed after dealing with a pesky high school debater. right? No one walks away saying, well, that kid made 27 really good points I had never heard before. No one's mind has ever been changed. The real goal, I think, should not be combating misinformation, but rather understanding why people fall prey to it and what news sources they are relying on, that, and then you can have a real conversation about it.
Right. So we're talking a lot about kind of all of these moves that are being made at HHS. Can we talk for a minute about the economic implications of how this is going to hit us? Because it's not just our health, it's our economy too, right?
Absolutely, Jill. And so a few things. One is you use the word economy, and I'm going to come back to that, but I actually want to start with innovation first, which is obviously closely related. By largely defunding many of the promising programs that the National Institutes of Health were pursuing, we don't know the innovations that the United States will never enjoy. And I know it's easy to make fun of the names of some of these studies. Why are they studying the saliva of a Gila monster? What a stupid thing. What could ever come from that? Well, you know what came from studying the saliva of the Gila monster? GLP-1 agonists, because in the saliva of the Gila monster was a peptide that appears, now we know, to significantly reduce blood sugar and suppress appetite. And so all of these things sound fanciful, but we don't even know what innovations will be left on the table undiscovered by the cuts to the NIH. And ultimately, our health is going to suffer and our economy. Now, specifically on the economy, though, pulling back on healthcare spending in the way that we have will spell ruin for a number of hospitals across the country. The health care will still be provided. Make no mistake, your health will still be taken care of if you go to the ER in a rural hospital without insurance. But who's paying for that care will change. And who will pay for the care is the hospital out of their increasingly dwindling charity care funds. And ultimately, those hospitals will run out of money. And much like paper mills of another generation, hospitals in many rural parts of the country are the anchor employer. And when the hospital closes, many towns will end up folding as a result of that. And so the implications for our economy, both rural and urban, because urban hospitals are also in jeopardy, those implications are still too early to even fathom.
Okay, thank you. So another Mainer, what's the latest status in public health appropriations? What can or are Democratic states or foundations doing to backfill some of the gap?
Great. Again, another shout out to my fellow Mainers. The outlook is not favorable right now, specifically on public health. The budget that has been proposed. Of course, again, we're 6 hours away from a shutdown, so in a sense, things are going to be changing very rapidly. But the budget that's been proposed and the House markup would gut the CDC to the effect of about 35 to 45% of its current domestic appropriation. Its global appropriation has already almost been zeroed out. What that ultimately means, though, is that that's money that goes to states. 75% of the CDC's domestic budget turns around and gets sent to state and city health departments. And so when you're looking at a 50+% reduction in the CDC's budget up to a 50%, what you're really saying is that the state health departments are similarly going to be gutted and challenged. And in the face of so many cuts at the federal government, whether it's to public health, Medicaid, SNAP, TANF, that's food for needy families, it will be difficult for a lot of state governments to make up that difference, let alone philanthropic foundations. So there are definitely challenges which heighten the importance in this moment of organizing and making your voice heard.
Thank you. So along those same lines, um, Do states have the ability to procure the vaccines um, for children without the federal CDC? And might we see some shortages down the road?
Great question. The answer is states can procure the vaccine directly from manufacturers. The CDC gets one of the best prices, in fact, the best price in town. But my understanding, and I'm a couple of weeks, months removed from this conversation, but the manufacturers of the vaccines, I believe, are open at least to the idea of providing that same price to states. Look, pharmaceutical companies lose money on vaccines. They don't make money on vaccines. So it behooves them to keep people vaccinated and make sure states can take advantage of that pricing. But where that money comes will be a challenge.
Okay.
Comes from will be a challenge.
So let's go back to our lack of global innovation that's going to be coming out of the US and back to us pulling out of WHO. Um, what are those implications? Who, and I'm curious, are there some countries that might take up the slack? I mean, I understand that we won't necessarily be at the front of the line, but who's going to be doing the research?
Um, Jill, I smirked at the way you framed that because I love your optimism. And I am, look, I know I sound a little down tonight. I know I sound a little like a Debbie Downer. That's just kind of my world. When I was at the CDC, the name of my softball team was the Wet Blankets. That's just kind of how I am. I want to be straight with everybody, even especially when times are a little bit challenging. So, Jill, um, you phrased it as, could other countries take up the slack? The answer is yes, willingly. That's not good for us, though.
Right.
Other countries, in light of the vacuum that the US government's departure from the World Health Organization leaves, other countries are clamoring to step in and fill that vacuum, not just at the World Health Organization, but on the ground in the places in the world where the next pandemic are likely to emerge from. Many of our most prominent foreign adversaries are chomping at the bit to get in the way that the US CDC and USAID used to occupy a position on the ground. Many of our adversaries can't wait to install themselves on the ground and help those countries and do research to fill that void. Their aims are not charitable, make no mistake. And in particular, that puts all of us in America at risk because, look, the number one question in a pandemic is how would we know? How would we know if and when the next Ebola outbreak is happening? And the way we've known for 5 decades is because the US CDC was on the ground looking. But if we have picked up stakes and moved back home and taken our ball and left, then other countries will know before we will. And in a pandemic, every hour of preparedness matters. If other countries have a 2, 3, 4 week head start, when it finally comes our way, we're going to be in bad shape.
So this is an interesting question. I'm fascinated to hear your take on it. Why do you think the anti-science movement takes hold in the first place? Like,
Good, good. I am fascinated by that question as well. And I have spent a lot of time thinking about it. I'm not a sociologist or an anthropologist, so I'm just giving you my unvarnished social science amateur's take, and that is two things. But they've both fundamentally come down to one thing that I've gained a much finer appreciation for, and that is it's a little wonky, but it's affronts to autonomy and dignity. I've talked to a ton of anti-science and anti-vax folks over the years. And when I ask them, why do you believe this? Going back to the earlier thing, I said, what often emerges is a story of them being disrespected, often in a healthcare setting, and taking that disrespect by a nurse, by a doctor, by a PA, by anybody, and then searching out for their own answers, and then falling down a rabbit hole. And so, this affront to dignity is one way that people generate antipathy toward the healthcare system, which, look, is a pretty bewildering and sometimes pretty disrespectful place to be. I've been yelled at and things of that nature as a patient. It's not easy. And so I think that's where a lot of this starts. The other thing, though, that I think happens is in large scale emergencies, even the slightest affront to autonomy, making folks feel that they are not in control, leads people to push back, to dig in their heels, to rebel, and thus search out answers. Look, in a crisis, the only thing you have is your credibility, because there are not answers in a crisis, not even close. All you've got is your credibility, but folks want answers, and they want easy black and white answers. And when health officials can't provide context, folks will naturally go where they can seek out answers, either because their dignity has been offended or their autonomy has been offended. And that leads them down the rabbit hole, looking for easy answers, which the internet is all too willing to provide.
Right. Now, you've addressed this earlier, but I think it bears repeating. So we've had several people ask, especially if someone's a senior, are they still protected from childhood vaccines? Should there be a major outbreak? So let's just hit that one again, just so that everyone's clear on.
Great. And great. I'm going to do that. And then, Jill, I might ask you for your forgiveness on another issue too. So let's tackle this issue of your childhood vaccines. The answer is if you are 100% sure that you either were born before the measles vaccine was indicated or definitely had the measles, the mumps, the rubella, the polio, all of those vaccines, if you are absolutely certain that you have had those vaccines, then the protections from those vaccines remain durable and in place. But notice my emphasis on if you are certain, because a lot of us are not certain. And so, if this is of concern to you, getting your antibody levels checked, it's basically like going in under the hood of your car and pulling out the dipstick to see where your oil level is at. Getting those antibody levels checked is quick and easy and something most doctors' offices can do with the draw of blood, and they can send it off to a lab. And the lab will be able to tell you, nope, your measles vaccine, we don't see really any evidence of you having gotten it. Let's get it again. Now, ultimately, if you don't want to go through that rigmarole, some doctors may just say, let's just go ahead and re-up your vaccine. And that's fine too, particularly if you live in a part of the country right now that's experiencing a measles outbreak. If you live somewhere like West Texas or Utah, and you're not sure if you've had the measles vaccine and you interact with kids in a daycare, now is a good time to call your doctor's office and either check your levels or just get the vaccine again. Joe, the other thing I wanted to take a moment is just to talk more broadly about the fall and winter, if I could.
Mm,
So, I mentioned a couple times confusion is the norm right now. And I do not want you to be confused about what you can do right now, this fall and winter, to keep you and your family safe. Number one, all of the major medical societies recommend that everyone 6 months of age and over get a COVID booster. Even if you got one last year, they've updated it a little bit. So get a COVID booster per the major doctors. Number two, get your flu shot. Same thing, everyone 6 months and over, get your flu shot this year. The third thing I want you to have on your horizon is a relatively new vaccine for a virus called RSV. The new vaccines have been out for that for about 3 years. We're going into the third season. Many of you maybe have already gotten that vaccine. I made sure my mom did when it first came out 2 years ago. If you haven't gotten the RSV vaccine, now is a great time to go get it. It lands a lot of people, very young and older, in the hospital every year. So, those are three concrete things that you can do right now to keep yourself and your family safe this fall and winter.
that's great advice. Um, Along the lines of more advice, any advice for those who are currently immune compromised?
Yes. If you are immune compromised, or if you live with somebody or interact with somebody, a parent, a spouse, a child who's immune compromised, the level of protections that you need to keep in mind this fall and winter are heightened. Some of them I would suggest you check in with your physician on. But let me just outline the basics. Number one, the three vaccines I mentioned, without a doubt. In addition, there are some other vaccines you want to triple check to make sure you're up to date on. For example, your pneumonia vaccine and your meningitis vaccine. You want to be belt and suspenders on those to make sure you've gotten them. You also want to think about if you are immune compromised, making sure you are masking up when you are in a public place or interacting with friends and family at home. Masking is still warranted for folks who are immune compromised, particularly again, as we go into what will likely be another flu season, another COVID season, another RSV season.
Great. A follow-up on RSV. Um, Somebody, another Mainer, is saying, I had an RSV vaccine and I've been told there's no booster. Is that accurate?
That is correct. The new RSV vaccine is still good. We don't know exactly how many years it's going to be good for. That's still under, that science is still working on that, but it's good right now.
Okay, thank you for that. Um, okay, changing gears here for a bit. Um, so as you know, I spend part of my time here in Maine. I'm currently in Maine. And a couple weeks ago, I saw an article in the local newspaper that reported that you might be considering a run for governor. Now, I'm not going to ask you to disclose anything, but I do want to know why you think state government is particularly important right now.
Well, thanks, Joe. I appreciate that. And you are correct. I am very, very seriously considering a run for governor of the state of Maine. And on as a Democrat, and just for avoidance of any doubt, um, and the reasons, Jill, particularly related to this issue, are partly what I've outlined already. First of all, there's too much at stake right now. For across the country, but certainly within Maine, our healthcare, our public health, our reproductive freedoms are being compromised. And the way in which those rights and freedoms will be protected, not just in Maine, but in other states, is through state government. And so, right now, as I think about what we can all be doing to stay safe, to stay healthy, and what my role in fostering that can be, serving as the next governor of Maine is for me the clearest pathway to protecting health, to improving lives, and protecting our rights and freedoms. Now, more broadly, I think governors have an outsized role to play in this moment. Much as I detailed, much of our system is being dismantled and misinformation is rife. Governors are trusted sources of information, and they're also the ones that are making a lot of these systems work at the ground level. So, not just in Maine, but across the country, we should all be supporting efforts of governors to keep all of us safe and healthy. I'm no different, and that's why it's important to me that Maine is prepared for this next chapter. Now, I've focused on health and public health. It certainly goes beyond that. But for me, relevant to this conversation, it's one of the most critical issues facing our state, and I want to make sure that we are in good stead for the next chapter.
Right, but we're not announcing anything tonight.
Nope, just strongly considering it.
Okay. Um, this has been fabulous. We cannot thank you enough. The thing I love about you, Nirav, is that we just get straight talk with incredible transparency and insight, and we thank you so much for that. I would encourage anyone on this call to make sure you share this video broadly because we need to get this information out. Um, and I would also encourage all of you to put on your recruiter hats and get more and more women involved because come the midterms, we need an army of women out there fighting for our democracy and fighting for state races in addition to federal races. One call out I would make is please mark your calendars. October 18th is the next No King's Day protest, and those are going to be happening across the country. And it is imperative that we show up in numbers too big to ignore. I think if you talk to any expert in authoritarian governments, the thing they will tell you is that we need to be visible and loud. And so I would encourage you to recruit your friends and make sure that you're attending that. Finally, programs like this don't happen without a village behind the work. And so I would like to thank Nina and Jen and Julia, and again, of course, Dr. Shah, for making this happen. And with that, we will sign off. We look forward to kind of watching any announcements that might be coming out here in the state of Maine. And please stay tuned for future speakers. We have some other terrific people coming up that we'll be announcing shortly. So have a great afternoon if you're on the West Coast. If you're on the East Coast, have a good evening, and we will see you soon. Thank you.
Thank you, everyone.
Nina.